Welcome to the 2021 Tribute to Courage Gala, an evening celebrating Casa Colina Hospital and Centers for Healthcare, and our mission to provide hope and healing for those who have suffered traumatic injury or illness. With your host, Bonnie Hunt, Casa Colina President and CEO, Dr. Felice Laverso. And now, here is your host, Bonnie Hunt.
Hi everyone, welcome to our Tribute to Courage Gala 2021. Of course, it's a little different this year. Last year we were all together in the same room, and actually that next morning I flew to Chicago, the 6 a.m. flight for what I thought was going to be a couple days stay. And because of everything that happened with COVID, I ended up staying in Chicago, of course, to care for some family members. I am a former oncology nurse, for those of you that do not know that about me. And so I'm back in full nursing mode here with family that was in need. And of course, we wanted to protect each other and keep the people that were coming into the homes, to a low number, to protect our elderly relatives, especially. And like many of you, it has been challenging, overwhelming at times. Sometimes it's been really sad because, we miss being able to hug each other and be close to each other and have the family together. And the days turn into, you don't remember what day it is. So it's challenging. And that's really what tonight's all about too. Just all that goes into somebody facing an illness, facing life-changing in an instant, and what it means to have something that's going to be a journey. And every little bit of progress makes a difference. Like right now, we're feeling hope, and we're grateful for all the frontline workers, all the doctors and nurses and the staffs and all the hospitals. Thank you for your courage and care during this time. That's why tonight's so important. Casa Colina provides that hope, the hope that we're all clinging to now for a brighter future, to go back to our normal that we took for granted. And that's what happens when your life changes in an instant from an injury or an illness, and you're not able to do what you used to do. You lose your independence. It's so terrifying and so scary. But when there's a place like Casa Colina, there's a sigh, just some relief and hope, and there's guidance, and there is amazing results. So many of you know what it's like to be at Casa Colina. For those of you who don't, they provide free and subsidized care for patients that are facing major challenges in their life from an injury or an illness. And when you see the triumph, there's the victories, the successes, the progress that people, what they overcome, these patients, it's amazing. And the care that's given at Casa Colina is 5-star, the highest standard, with compassion and professionalism. I can't tell you how impressed I am by everybody that works there. And of course, mostly impressed by the patients, their courage and their progress. I want to tell you a lot about Casa Colina, and we're going to show you a video here in a minute. But tonight's honoree, Joanne Lishman, she embodies all that is possible when a courageous spirit meets Casa Colina's continuum of care. All of our lives are affected. All of our families are affected at some point by life changing in an instant. And when it does, the next sentence you want to hear is, there's something we can do about it. There's help and there's hope. And now, for those of you who might be joining us for the first time, I wanted to share a little bit more about Casa Colina. Casa Colina Hospital and Centers for Healthcare is an independent, nonprofit provider of medical, surgical, and rehabilitative care, serving children and adults in our community since 1938. Since our founding by Frances Eleanor Mother Smith as a treatment center for children with polio and other disabling conditions, Casa Colina has continued to expand our services, establishing the gold standard for patient-centered medical and rehabilitative treatment.
Today, our continuum of care includes 223 beds consisting of medical, surgical, and intensive care, inpatient rehabilitation, short-term residential rehabilitation, and long-term residential services for people with brain injuries. In addition, Casa Colina offers outpatient therapies, specialized physician clinics, children's services, diagnostic imaging, and an outdoor recreation program. Casa Colina is more than just a house on a little hill. It is a place of hope. We are proof that after serious injury or illness, with exceptional care and hard work, a brighter future is always possible. Compassion, collaboration, integrity. Casa Colina brings its core values to life through the miraculous work that takes place here each day. Our 85-year legacy of hope and healing has helped hundreds of thousands of individuals to increase their independence, maximize their health outcomes, and live their best possible lives.
And now, Dr. Felice Laverso.
Good evening, and thank you for joining us for Casa Colina's Tribute to Courage 2021, the first and hopefully the only virtual version of this beloved fundraising event. And to those of you who are joining us for the first time, a warm-hearted welcome. For any medical institution, this past year and the struggle against this pandemic presented so many challenges. I am proud to report that Casa Colina rose to those challenges and met them head on. I am so inspired by the way our medical team and all of our staff faced those obstacles together, and as always, placed patient care first. In 2020, we expanded treatment space to safely provide socially distanced care for more and more patients. We implemented a mandatory employee testing program, and we invested well over $2.6 million in PPE, building modification, and enhanced environmental and housekeeping services. Our employees and leadership teams acted with selflessness and integrity to keep our patients safe during an extremely trying time. They ensure our continued success during this public health emergency. Thank you all so very much. I want to take this opportunity to recognize the work of so many talented individuals who contribute to the success of Casa Colina. Our board of directors, our clinical staff, our administration, and our dedicated volunteers are the best at what they do and make it all so very possible. Without their combined efforts, we simply could not provide the highly specialized care that makes Casa Colina unique. I would also like to express my gratitude to the major sponsors of this year's Tribute to Courage. These individuals and organizations partner with us in this community, helping us to realize our critical mission. With their help, Casa Colina is able to continually expand our specialized medical, surgical, and rehabilitative care to improve the vitality of this community. These generous donors are a part of our 85-year legacy of hope and healing. And now it's my honor to introduce a friend, an artist, Miss Bonnie Hunt. So nice to see you again, Bonnie.
I am honored to be in any way a part of this fundraising and making a difference in all these patients' lives like you do every single day.
Well, that's kind of you to say, but how's the year been for you? I mean, it's been such an odd year for all of us.
Yeah, I think everybody's been going through the same thing. At first, it was like, oh, okay, I can do this for a little while. And then it became daunting, overwhelming, all the days blending into each other. And then, of course, just being kind of cooped up with family 24/7. Everything's fine until you hear the phrase, what's that supposed to mean? And, you find the highlights in it, and then you find the hope. And that's what tonight's all about.
Yeah, I wish we could be together, though. I really do. It would do my heart good to see you and to be able to put my arms around you a little bit.
Yeah, give each other a hug. I feel the same way. I got to tell you, Phil, the privilege to have a front row seat to the progress that these patients make when they're so overwhelmed and life is so scary and it's changed in an instant. To have Casa Colina there and all the work that you guys do is just... it's remarkable, it's unbelievable, it's life-affirming, and I feel honored to be a part of tonight's event.
But Bonnie, what makes Casa Colina really special, people like you that support Casa Colina day in and day out.
Thank you. And thanks to everybody out there who's contributing tonight and being a part of this event. You are really making a difference.
And with that, I'd like to introduce our Tribute to Courage honoree, Joanne Lishman. Joanne came to Casa Colina's Transitional Living Center in 2011 as a patient with a spinal cord injury, 2 months after suffering a catastrophic car accident. Joanne's injury changed the trajectory of her life forever. Thankfully, Joanne found Casa Colina, and with her own perseverance and the support of her clinical team, was able to see that a brighter, more hopeful future was possible.
I was injured on Labor Day weekend, 2011. We were coming home from a friend's house from dinner, and a car hit us going through the intersection. We were thrown kitty corner across the intersection and smashed into a light pole, and our car was essentially accordion. I can still smell that strong smell of blood. I couldn't move. I heard my husband groaning. I was sure he was dying. I was sure I was dying. I couldn't move my arms, my legs, my head. I didn't know why. I didn't know what was happening. And then at some point I heard my son say, "Mom, I think I'm okay." But I couldn't turn my head to look at him or see where he was. And I just said, "Sam, take my purse and take care of your little brother." And that's the last thing I remember. When I got to the hospital, my neck was broken in 2 places. My spinal cord was severed, my right arm was shattered. I had a lot of injuries. I had a 9-hour surgery where they put 10 levels of metal rods and plates to rebuild my neck and my back. And they fitted a 15-pound metal halo into my skull. It was sort of on both sides of my skull screwed in, and then it screwed in at the bottom to keep my neck and back stabilized. That was very painful because your head is suspended in the bars. You're digging into your head and your back. I would say about a week or so after being in the hospital, the doctors came to me and said, "You're a quadriplegic." I remember they said, "You're paralyzed from the neck down. You'll never do anything you used to do again. You'll probably never walk again. Very few people with your injury do. We're recommending that you be transferred to a nursing home because you won't be able to do rehab and there's no point." You know, an accident is just that, right? It's an accident. Nobody's planned for it. You never think it's going to happen to you. But when it does, your life is devastated and everything is taken from you. And you learn to lean on family and friends, and you learn that that's okay. There's no shame in leaning on family and friends. I was so lucky and blessed to have amazing family, my parents, my sisters, my husband, my kids, so many friends rallied to help us. And we had a friend who told us, "You need to get to Casa Colina." I was brought by, ambulance, stretcher to Casa Colina, arrived in my halo, in my wheelchair. I couldn't do anything. And they took care of me medically, they took care of me physically. I needed 24/7 care, but it was like they didn't see the halo, they didn't see the injury. I'll never forget being wheeled into Dr. Patterson's clinic the first time I met him, and he asked me, to move my foot or my toe, and it was pretty imperceptible to me, but he just got a big smile on his face and said, "You stick with us, you're gonna do great. You're gonna have to work hard, but you're gonna do great." And he was the first person since my accident that gave me hope. And it was absolutely pivotal.
My understanding was neurosurgeons from the hospital she came to told her she'll never walk again. So, Joanne was not very optimistic about what her recovery would be, but when I did my physical exam, it was quite different than what was documented on the paper. And so immediately I thought, well, this is great. She's gonna have a good outcome. We just need to fulfill it.
It was grueling and difficult. It was about 9 to 3 every day. Every hour was something different. You had a schedule. They pushed you so hard and they took what they did so seriously, but they always saw you as a person. They always saw you as somebody with a life. And they gave you so much dignity. And they wanted you to get to the goals that you set for yourself. And they would do anything to help you do that.
I think Joanne has a perfect combination of the things that one needs to succeed as much as they can in rehab, right? She had the attitude, that positive attitude of like, hey, I was dealt this bad deck of cards, but I'm gonna get all my aces out to whatever degree I can. And I also think she was determined. No matter what someone was gonna say to her, she was gonna do as much as she could. And if she didn't get back to 100%, she was willing to accept that. But she was working so hard to get to, if it was 99.5, she was gonna get there.
She never faltered in her commitment to get back to her function as a mother, as a wife, that she battles every day, and she battles it with a great attitude. And I think that when she's in a support group, I know that other patients of mine have come up and said, wow, Joanne's an inspiration for me. She talks so highly of Casa Colina. I can let you know that, I look up to her. So I think she has become, a role model, an influencer for other people's journey through their recovery from spinal cord injury.
I think when I think of courage, I think of course, pushing as hard as you can to get as functional as possible. But I also think of acceptance. And I think that acceptance when you have an injury it's not resignation, but it's a willingness to accept your limitations and work with them and just try to find as much joy as you can every day. And one of the things that gives me a lot of satisfaction is being able to talk to people who are injured, have a spinal cord injury or some other injury, and they can't see their future. And you really mourn for your past life, But someone said to me, and I like to try to pass it along, you can never get your old life back, but your new life can still be beautiful. And that's what Casa Colina gave to me.
Wow, what an amazing story. What a journey for Joanne.
Yeah, a patient spirit and strength, along with a bunch of unbelievably gifted clinicians. Joanne just rose above it all. Just amazing to me.
When you push yourself physically and mentally and you have the TLC team there at Casa Colina, it's going to be successful.
Joanne, we are truly humbled and honored to have served you. Please accept the Tribute to Courage Award on behalf of all patients served and yet to be served. Thanks for inspiring us with all your hard work, commitment, and hope. And now, Bonnie, I have a little surprise for you. Since we can't be together in person, I want to take this opportunity to show you all where the real magic happens, behind the scenes at Casa Colina. I wanted to bring Casa Colina to you. Are you up for that?
Let's go. Let's do it.
So here we are at the front of Casa Colina. The people are really at the heart of everything we do. So I'm ready to take you on a VIP special tour of our beautiful 20 acres and introduce you to some of the wonderful, incredible, gifted clinicians that make Casa Colina what it is today. So let's go. As we walk in, it is a mission-style institution. Here are some of our first line people that you meet when you come to Casa Colina. Hi guys, how you doing? This is our founder, Frances Eleanor Smith, affectionately known as Mother Smith, who founded Casa Colina 85 years ago as a home for children with polio. It was a nonprofit 85 years ago, and we remain as an independent institution 85 years later. And if we go this way, we see a courtyard on our left. It's a very significant courtyard because as families are told either good news or bad news, they need to center themselves. So you'll see many courtyards along this tour. And as we continue to walk, This is our donor wall full of photographs from 1930s all the way to the present time. It also signifies the unbelievable support that Casa Colina receives from so many individuals over the years. Without this support, Casa Colina could not exist. We do over $7 million worth of community benefits on an annualized basis. This is really a special, special place. And here we are in our inpatient gym where people are recovering from strokes and traumatic brain injuries and spinal cord injuries and such. It has all the most modern equipment, but the most important piece of everything that you see in this gym are the people treating the patients. These are the people that make the magic possible right here in front of us. And as we continue the tour, we created an outdoor gym space in this wonderful environment. Oh, and here's Melissa Howard. How are you, Melissa?
Good, thank you.
Melissa is a well-published researcher herself. She has defined swallow studies for people with disabilities. And Melissa, have you seen your programs expand while we've been together all these years? How many years now you've been at Casa Colina?
Almost 20 years.
God bless.
And Casa Colina has grown so much since I've been here. I've had the opportunity to see all these buildings go up and see our patient population expand to maintain our census at a very high level.
And how about the staff? You've seen the staff expand as well, haven't you?
We've all grown so much, and we have such a wonderful research department and leadership that facilitates growth for all of us so that we could be the best for our patients and for this community.
And as we continue the tour, hi, Kathy Templey, how are you?
I'm fine, thank you.
Kathy, tell us what goes on in Casa Colina a little bit from your perspective.
When people come in the door, they come see us, we work on their mobility, and we do see a lot of different changes in them.
Every single time we read about patient satisfaction, your physical therapists are always at the highest level. Why do you think that is?
You know, I think the attention to the patient, and we respect the uniqueness of each patient. We look at their goals and we work together with them with a common goal, try and get them where they want to be. So I think that's really part of our success in PT, is to be able to speak to that and work with patients in that way.
Have you seen expansion in Casa Colina in your own department? Have you seen equipment changes?
Oh, absolutely. We are so well supported. We have lots of up-to-date technology. We can use it with our patients and different tools to get them going.
And Kathy is a living example of one of those individuals that help patients achieve their maximum potential of recovery. And for that, we're indebted to you, Kathy, and to your whole team.
Thank you very much.
Hey, Chris, how you doing? Nice to see you. Good job. And as we exit the gym, we come to our history wall, beginning in the 1930s, all to the present. And also while honoring the past CEO who spent 28 years at Casa Colina. His name is Dale Azell. But as people come through this hallway, they can stop and look at our rich, rich history from the early years of polio through its redefinition as a rehabilitation facility to its present form as a comprehensive center from medical surgical unit all the way through post-acute care.
Hi, Dr. Loverso.
Hey, Sella, how are you? Sella runs our occupational therapy program. She comes to us all the way from New York. And what special did you find? I mean, you worked in many hospitals in your lifetime. Do you find Casa Colina to be different from some of those other facilities?
As an occupational therapist, it's an honor to be at a place where the patient comes first. They are our first and foremost priority with the rehab mindset.
One of the special things for me at Casa Colina is that we continue treatment even after funding runs out. Do you find that to be helpful as an occupational therapist to get people back to a functional level that they can go home?
It's not just helpful, I think it's truly life-changing, because if it was my family member who could not afford to extend their stay here, but had a lot more potential for full recovery and a meaningful recovery, it's just beyond amazing to be able to support that and continue and help them through that process.
From my heart to yours, I want to say thank you for being here and thank you for all that you do for our patients.
Thank you, Dr. Loverso.
Now we're entering the hyperbaric chamber area. It's also our wound care area at Casa Colina. And hello, Dr. Gott, and hi, Jessica, how are you?
Hi.
Now, Dr. Gott, you and I go back a long time. What brought you to Casa Colina?
Here we do wound care for patients that have had surgery or have diabetes or have venous disease. At the same time, we developed the Hyperbaric medicine program where we treat patients that have had amputations or have diabetic foot ulcers, burns, and a variety of other kinds of wounds.
What makes it special?
To be able to come in here and treat our patients with hyperbaric chambers and help facilitate their healing is just something that you don't see at every facility.
So thank you both. We are indebted and lucky to have you both as part of the Casa Colina family.
Yes,
thank you.
Absolutely.
All right, we're entering one of my favorite courtyards at Casa Colina. Hey, Emilio, how are you? It's good to see you, pal.
Good to see you too.
I've known you many, many years. And you started on the floor as an LVN, and then you worked to get to where you are right now.
I started as an LVN, then the opportunity was given to me to become a case manager, and I'm grateful that I was given that opportunity. And that made me decide to pursue my career, and with the Casa Colina support, I was able to accomplish that. And now I became an RN, and I've been at Casa Colina for 15 years, and I'm not looking to move.
And both as a nurse, case manager, and now as a nurse again, you have seen, I know because you've asked me so many times, can we extend care of patients once their money has run out, their insurance has run out. I think it makes Casa Colina a very special place.
Our patients come first, and we strive to do the best that we can for them.
Well, brother, you know we're family, and we love you for everything you do. And
thank you,
thank you,
Dr.
Emilio.
Thank you, Dr. Loverso.
Hey guys, how are you? Nice to see you all. Hey, good to see you guys. How you doing?
Doing well.
Yeah, you hanging in?
Yeah, we're doing good.
Busy, busy, busy. It's great.
All the time.
Yeah, thanks, pal. Good to see you guys. Hey, Katie, how you doing?
Hey, Dr. Loverso, how's it going?
Great. So you're our Chief Nursing Officer, such an important role at Casa Colina. What do you see special about Casa Colina?
What do I see special? I don't think I'd ever worked anywhere where there was this collaboration that existed between so many different disciplines. You have this meeting once a week where you have respiratory therapists, speech therapists, occupational therapists. You know, we have people coming in that are working with prosthetics, and you know, you've got neuropsychology and like rehab doctors, and then
research.
You'll have research, and it was just beautiful to see like this team of people that just came in and just looked at everything that was going on with the patient and did everything they can to make sure the patient and the family were ready to go back into the community.
It's so fortunate for the patients that wind up here, isn't it?
So thankful, yeah.
Well, thank you,
awesome.
Katie, for all your contributions, and you, future at Casa Colina, you're one of the future leaders here, and I couldn't be more excited and proud of you. Thank you for being here. You're in the newest part of our gym. As one of the consequences of the COVID-19 pandemic, we had to create more space to treat the same number of patients. This used to be a meeting room where 120 people could come from the community and utilize these rooms. Once the pandemic hit, we had to convert every available space to treatment space as our patients needed social distancing and being completely safe from each other as well as from our clinicians. So this is a result, what you see, of the pandemic. One of my favorite places on campus is a tribute to my mom and dad. When my parents passed, the physicians of the community raised $50,000 and bought this fountain in memory of my mom and dad. So every morning, my office is right across the courtyard. I can say good morning and good night every night to my mom and dad. It's very special, very emotional. So to those physicians and to all the people who supported me, thank you ever so much. So how you doing, pal?
Good, thank you.
You're looking fantastic as always.
Thank you.
Now who's up behind you?
My therapist, Ryan.
Hey, Ryan, how you
Here I
doing,
am.
pal? What you doing here, Ryan?
We're doing some gait training with Eric here. We're able to use robotic technology to assist us with some of the gait type goals to help the patient gain some more motor control and help Eric here reach his goals.
I want to ask you, Ryan,
Yeah.
what draws you to Casa Colina?
So I first came to Casa Colina for the neuro residency and obviously for the reputation in rehab. And then as soon as I found out about the opportunity for gait and robotics, I really wanted to get on that quick to expand the program here. So it's been a really, really successful, really exciting moment for me, hopefully for Casa Colina, hopefully for my folks like Eric as well, to just be here and be a part of this whole organization.
And how does it feel to be in this equipment?
Awesome. Really good.
Yeah, you look great. You look absolutely great.
Thank you.
And you're taller than I thought.
Yeah. Sometimes I forget how tall I am, but here I am.
No, you look fantastic. You look great. And how does it feel? Are you making progress?
Yeah, I feel good. I feel stretched out. You know, it feels good to stand, you know, as our bodies are meant to stand, so it feels good.
Well, I know that I speak for Ryan and all the other clinicians at Casa Colina. We're humbled to treat you, and it's a privilege to treat you. Thank you, sir.
Yeah, Dr. Loverso, this is my second home.
God love you.
It's awesome.
Just God love you.
Yeah, thank you.
And good luck to you, okay?
Thank you so much.
Okay. Thank you, guys. Well, I hope you enjoyed the tour of Casa Colina and meeting some of the people that make the magic happen. I want to thank you for all your support, and we look forward to seeing you next year. Thank you ever so much.
Well, that was comforting, inspiring, uplifting, and so impressive. Look at all those healthcare workers. Every year, Casa Colina recognizes a nurse who exemplifies high quality patient care and seeks new knowledge to advance the profession.
This year's winner of the Bonnie Hunt Nurse Award is Lahia Lanuza. She is an RN and BSN on the telemetry unit of our medical surgical wing. She also works as a relief charge nurse and is a certified orthopedic nurse. She provides critical support for our Revived Joint Replacement Program, including preoperative training for our Spanish-speaking patients and families. She's just this incredibly sensitive, bright, caring human being.
Lahia certainly has distinguished herself among Casa Colina's excellent nursing staff because of her compassion and clinical experience.
She is also a valued preceptor for our new graduate nurses. She is currently pursuing a master's degree in nursing, specifically licensure as a nurse practitioner.
Congratulations, Lahia, on this wonderful achievement. You make us all at Casa Colina so proud.
We also congratulate our 2021 Tribute to Courage honoree, Joanne Lishman. Joanne, I look so forward to seeing you at Casa Colina soon, when we can present you with your award in person. A big reason Tribute to Courage has always been such a successful event is our longtime friend, Bonnie Hunt. Bonnie has given comfort and kindness to our honorees and has been a loyal supporter of our clinicians and caregivers. She always finds a way to remind us of what's important and inspire support for our patients and families. Bonnie, you have left such an indelible mark on our beloved Casa Colina. We miss having you in person this year, but look forward to seeing you next year. So thank you so very much, Bonnie, from my heart to yours.
Well, thank you, Dr. Loverso. It's an honor to be a part of all the incredible work that you guys do, a small part of it. I love you and appreciate you. And thank you, everyone, for joining us tonight. What a great night.
And thanks to all of you for joining us. We look forward to seeing you all in person for the 2022 Tribute to Courage. And now I would like to introduce Bonnie Scudder, Casa Colina's Chief Planning and Development Officer and head of the Casa Colina Foundation.
Thank you, Dr. Loverso. At Casa Colina, we know that sustaining a healthy community means reaching its most vulnerable members. Your generous donations allow us to offer specialized services and other vital community benefits to those who are in need but lack the coverage to afford them. Last fiscal year, your support helped Casa Colina Foundation to provide $7.9 million in free care, subsidized care, and other community benefits. On behalf of the 25,000 patients we served in 2020, we'd like to express our gratitude to the individuals, foundations, and businesses who offered that support. Whether in the form of event sponsorship, employee contribution, or direct donations, The gifts you give go directly towards improving patient outcomes and have a lasting impact on the vitality of the community we all call home. When you give to the Casa Colina Foundation, you're giving more than just free care. Your gifts also support clinician training, medical research, and other health education for our community. We sincerely could not do it without you. As always, your donation to Casa Colina comes with a promise. We will maximize every dollar we receive to generate the greatest possible impact for our patients. Patients like Joanne Lishman, who, with the help of Casa Colina, faced the challenge of a life-changing injury to reclaim a level of function that lets her imagine a brighter future. This past year has been difficult in so many ways. All of us at the Casa Colina Foundation have been amazed at the dedication and generosity of all of our donors, who have continued to support us even during this pandemic. We thank you all. We look forward to a brighter future when we can get together safely again to celebrate Casa Colina's courageous patients. Good night, stay safe, and thank you all for supporting Casa Colina's patients and families.